can start the free paper now. Requesting all the presenters to be stick in time. So first paper, presenting author is Dr. Dhania BC. Inside.
Good morning. Myself Dr. Dhania. I am presenting the topic Bitemporal hemianopia, Divulging the surprises. Bitemporal hemianopia is a classical visual field defect associated with the chiasmal involvement. As you all know that the nasal fibers of the retina decussate at the chiasma and join with the temporal fibers at the chiasma, and that will result in any damage to that area that will result in bitemporal hemianopia. So these are the common etiology involved the chiasma: compression, inflammation, demyelination, infiltration, and ischemia. Among these, compression is the most common cause, and in that we are commonly see diseases like pituitary adenoma and craniopharyngioma. We have carried out a retrospective study where we found out other causes of bitemporal hemianopia, which include glioma, meningioma, epidermoid cyst, trauma, acute zonal occult outer retinopathy, TB, arachnoiditis, ethambutol toxicity. So first three that comes under compressive lesions. Coming to the first case, a 19-year-old girl presented with the defective vision right eye for 2 years, left eye for 3 months, associated with headache. Vision is 6/6 and both eye fundus shows temporal parallel of the optic disc. An HFA shows bitemporal hemianopia and MRI suggestive of optic pathway glioma. Patient underwent right three-diagonal craniotomy and decompression of the tumor. After 2 weeks of post-op, vision was 6/6 with the no resolution of the field defect. Another girl, 16-year-old, presented with the sudden onset defective vision right eye. Right eye vision 1/60 and left eye 6/6. With fundus shows right pale disc and left eye shows temporal parallel of the optic disc. MRI suggestive of epidermoid cyst, and that patient underwent right diagonal craniotomy with gross excision of the lesion. In post-op vision improved in right eye. 52-year female patient presented with a defective vision right eye. Vision right eye 6/12, left eye both eyes 6/12. Fundus shows temporal parallel of the optic disc. An MRI suggestive of meningioma involving the planum sphenoidal and diaphragma cellae, compressing the optic chiasma. Unfortunately, we lost the follow-up. Under male with prior history of trauma presented with a defective vision right eye. Right eye shows pupil involving complete Turner palsy, and the fundus shows both eye temporal parallel. And MRI is inconclusive, and we treated conservatively. Next case is a 43-year-old male presented with defective vision on the temporal side. Both eye vision is 6/6 with the right eye fundus shows right eye anterior vitreous facial with the peripapillary and peripheral RP changes, and left eye shows peripheral RP changes. And it was diagnosed as acute zonal occult outer retinopathy, and it was treated with the steroids. The next two patients presented with tuberculosis on ATT and with defective vision both eye. Fundus shows both eye temporal parallel and field shows bitemporal hemianopia. And we proceeded with the MRI, and the first case it shows features suggestive of TB arachnoiditis, and it was treated with the ATT. And next case, the MRI was normal. The VEP shows with decreased amplitude, and it was diagnosed as ethambutol toxicity. And we discontinued the ATT, and the field improves. So, on concluding, there are rare presentation of bitemporal hemianopia other than pituitary adenoma and craniopharyngioma, and it is very important to investigate patients with a temporal parallel with good vision. Thank you.
A very interesting and a very good presentation. Only thing is you could have added that what the incidence of each diseases. For example, you mentioned tuberculosis. So the incidence in our country, that you could have added.
Okay.
Because it's so common
to
have tuberculosis
so
and pituitary adenoma, isn't it?
Yes.
Good presentation.
Thank you, madam.
any other toxic amblyopias, any other toxic nutritional toxic, those etiologies did you just come across with this?
No,
You
bitemporal
studied with these
hemianopia,
diseases?
no, madam. Other central
Just
scrotum
temporal.
is there, but bitemporal hemianopia, we usually dealing with the ethambutol toxicity only. We are doing one study on that ethambutol toxicity.
Okay, thank you.
Thank you.